Hello everybody. Today's topic, Flagyl, also known as metronidazole. Have you taken metronidazole before? Do you have a loved one that's taken metronidazole before? If so, you should definitely watch this video. Again, Flagyl, or metronidazole, is an antibiotic used to treat bacterial infections in different areas of the body. It is also used to treat infections caused by bacteria or parasites, which includes gastrointestinal, reproductive, or V infections. I don't think I can say that on TikTok. It is available in the following dosage forms: suspension, tablet, capsule, powder for suspension, cream gel, and lotion. Metronidazole oral tablets and capsules have a black box warning. This is the most serious warning from the US FDA that indicates a drug has dangerous or serious side effects. Black box warning is for cancer warning. Because of this risk, metronidazole should only be used to treat conditions as approved by the FDA. Usage warning. To reduce the occurrence of drug-resistant bacteria, metronidazole should only be used to treat or prevent infections that are proven or strongly suspected to be caused by bacteria. Now, adverse reactions. Get ready. First group, central and peripheral nervous system effects: encephalopathy and peripheral neuropathy, and optic neuropathy. Encephalopathy, an association with cerebellar toxicity characterized by impaired balance, dizziness, and slurred speech. Persistent peripheral neuropathy has been reported, just like for fluoroquinolones, so patients should be specifically warned about these reactions. Does that happen? In addition, patients have reported headache, fainting, dizziness, vertigo, incoordination, impaired balance, tinnitus, hearing impairment, hearing loss, confusion, slurred speech, irritability, depression, weakness, and insomnia. Also reported convulsive seizures and aseptic meningitis. The next category, gastrointestinal. The most common adverse reactions reported have been to the gastrointestinal tract, specifically nausea, sometimes accompanied by headache, anorexia, and occasionally vomiting, diarrhea, epigastric distress, and abdominal cramping and constipation. Next, mouth. A sharp, unpleasant, metallic taste, furry tongue, tongue inflammation, and painful swelling sores inside the mouth. This usually occurs with a sudden overgrowth of candida, which happens while taking metronidazole. Dermatologic issues, blood issues like low white blood cells, and low platelet levels. QT prolongation has been reported, particularly when metronidazole was administered with drugs with the potential for prolonging the QT interval. Now, this would definitely be a case if Flagyl was used with a fluoroquinolone, because the fluoroquinolones also have an adverse reaction of prolonging the QT interval. Next category, hypersensitivity, TEN, Stevens-Johnson syndrome, SJS, and DRESS, and AGEP. Renal issues such as painful urination, cystitis, polyuria, incontinence, a sense of pelvic pressure, and darkened urine. Severe, irreversible, acute liver failure, including cases with fatal outcomes with very rapid onset after initiation of systematic use of metronidazole. The FDA document states that this can happen within 2 days. Proliferation of candida, you know where? Prostatitis, rare cases of pancreatitis. For many reasons, in a long paragraph in the FDA insert as well as the Pfizer insert, Crohn's disease is not an approved indication for Flagyl or metronidazole. Patients with a prior history of metronidazole or other nitroimidazole derivatives should not take Flagyl. Prescribing Flagyl capsules in the absence of a proven or strongly suspected bacterial or parasitic infection or a prophylactic indication is unlikely to provide benefit to the patient and increases the risk of the development of drug-resistant bacteria and parasites. Patients should be counseled that this medication is only used for bacterial and parasitic infections, not viral infections. For pregnancy, metronidazole crosses the placental barrier, and its effects on the human fetal organogenesis are not known. For nursing mothers, metronidazole is present in human milk at concentrations which they claim are close to therapeutic levels. I would not feel comfortable about that. You know, in all these videos, I have to say, here we go, guys. This video is based on my experience and is for informational and educational purposes only. I am not a doctor. I am not here to treat, diagnose, cure, or prevent any illness or disorder. Please work with your healthcare provider to do so. However, I did create this video because I continually get people talking to me about Flagyl and how they are disabled too, how they have had such severe adverse effects, just like those of us that have been harmed by fluoroquinolones. Some people were taking metronidazole and fluoroquinolones at the same time. They got hit really hard. So I felt like it was really important to make this video to talk an antibiotic which you may have taken, may have not taken, may have heard, may not have heard, but in either case, it's information you need to know to make an informed healthcare decision for yourself. You know, I'm always talking about fluoroquinolones, and we always say, if there's an alternative, ask for one. In the case of metronidazole, I think that's a little bit more complicated because I think this medication is used for very specific bacteria and infections, but in any case, I don't think it would hurt to try to request an alternative if there is one. If there isn't, that's a different story, but if there is, you might be able to avoid some of the hardships that other people are experiencing due to taking this medication. Hope this video was informative and gave you all the information you need to know about Flagyl, metronidazole. I seriously had to say this like 100 times. I kept messing that word up. I think that's it. That's all I got. Thanks, everybody. Association. Metro. I'm gonna say Flagyl. It's easier. Metro. With resultant with. Oh my God. With metronidazole has been recorded to. I can't speak. Or